Hello everyone, in the present video I am going to discuss MCQs in cardiopulmonary physiotherapy with answer. Let's see. Number 1. Maximum diaphragmatic movement is dash centimeter. A 1 centimeter, B 2 centimeter, C 3 centimeter, D 4 centimeter. Here the answer is C, that means 3 centimeter. Let's see the second. The position of lung is up to dash. A. T8, B. T10, C. T12, D. T7. So the answer is B, that means T10. Let's see number 3. Raynaud's disease is dash. A. Arterial disease, B. Venous disease, C. Lymphatic system disease, D. None of the above. The answer is A, that is arterial disease. Number 4. The capacity of the bag recommended for manual hyperinflation in infants is A 100 ml, B 500 ml, C 1 liter, D 1.5 liter. The answer is B 500 ml. Number 5. FEV1 FVC ratio may increase in dash. A. Airway disease, B. Obstructive airway disease, C. Restrictive airway disease, D. Interstitial airway disease. The answer is B. Obstructive airway disease. Number 6. Venous return during exercise is augmented by all of the following except dash. A. Vasoconstriction, B. Muscle contraction, C. Abdominothoracic pumping mechanisms, D. Intestinal motility. The answer is D. Intestinal motility. Number 7. Sympathetic activity of the heart leads to dash. A. Increase in the HR, B. Slowed conduction through the AV node, C. Decrease in the HR, D. None of the above. Here the answer is A. Increase in the HR. Number 8. Ideally the endotracheal tube should not extend beyond the dash. A. Base of the tongue, B. Pharynx, C. Larynx, D. Carina. The answer is D, that is carina. Number 9. Who is considered as father of CPR? A. Peter Seffer, B. Robert Seffer, C. Christian Bernard, D. Enthoven. The answer is A, that is Peter Seffer. Number 10. The value of resting metabolic rate O2 uptake, which is called 1 MET, is dash. A. 3.5 ml per kg per minute, B. 3.7 ml per kg per minute, C. 4.5 ml per kg per minute, D. 4.7 ml per kg per minute. Here the answer is option A, that means 3.5 ml per kg per minute. Thank you.